wearing red to bring awareness for women's heart health. Tomorrow is Wear Red Day, the American Heart Association's Go Red Friday.
According to the association, one woman dies just about every 80 seconds because of cardiovascular disease. And joining us now to discuss Go Red Friday and also heart health is Dr. Poulia Uddin with Scripps Women's Heart Center. Doctor, great to have you with us.
Hi,
Thanks
thank
for being
you.
here.
Yes.
So these numbers are just staggering. What can people do to try to reduce the number of those who are affected by heart disease?
Oh, it's such a good question. You know, first of all, it's actually just getting the information out there. You know, traditionally, women don't think of heart disease as the thing that's going to get them. They're focused on all of these other maybe OB issues and, you know, things that come to mind when you think of a woman, but it actually is the #1 killer of women. You know, all sorts of things, heart attack, stroke. You know, when you say heart disease, there's a lot that encompasses, arrhythmias, you name it. So first, it's just educating women like, hey, maybe this is something you actually need to think about in addition to all the other things you're thinking about, you know, on a regular basis. And the other, you know, the other really important thing too is we even still know this, even though the information's out there and we have these wonderful Go Red campaigns and we have a Women's Heart Center and people are aware of it, women's heart disease is actually still underdiagnosed, underrecognized, and undertreated for a number of reasons, even by physicians who are actually looking for it. The symptoms can be very different in men and women, so just a lot of it goes missed, unfortunately.
Okay, let's play a little myth or fact.
Okay,
I'm
let's
going to
do it.
make some statements, and you tell us if this is a myth or a fact.
Okay.
Heart disease is only for men.
Obviously, that's a myth.
Heart disease is only for old people.
Also a myth, you know, and for actually just to extrapolate on that, so heart disease can mean so many things. It can mean what we think of as a heart attack or a blockage in an artery, but it can be an electrical problem or an arrhythmia, and some of those are congenital. People can actually be born with them. So there's babies with pacemakers, which is actually sad. You know, and then there are a lot of actually specific heart conditions in women that are a lot more common during pregnancy or peripartum, so right after pregnancy, which is obviously younger women, and postpartum. And so it can, and then certain really unique conditions like spontaneous coronary dissection, which a lot of people haven't even heard of, a lot more common in younger women. And so can be missed for that reason alone, because maybe a young woman isn't necessarily thinking there's something going on with her heart, and also not looked for all the time. So myth.
All right. Heart disease won't affect me because I'm physically fit.
Also a sad myth. I know I like to think the same thing myself, but you know, same thing. You know, there's a lot of risk factors that people know of. You know, smoking, you know, being overweight, diabetes, hypertension, all of those things contribute. Unfortunately, there's a lot of things we can't control that contribute to heart disease as well. So even if we're exercising and eating everything perfect and being vegan or, you know, whatever you're doing, if you've got a strong family history, your genetics, unfortunately, you're born with. And so that plays a huge role. Something in your environment, let's say you're doing everything right, but you've got a tremendous amount of stress or there's some other illness going on like an inflammatory condition, all of those contribute even under your best intentions. So,
will you talk more about vegan, because there are so many documentaries.
I wish I hadn't said it.
Well, no, but there are a lot of documentaries, and the idea is that if you exercise regularly and you eat a plant-based diet and you get rid of the animal products, the fast food, the sugar, obviously no smoking and alcohol, you can even reverse some of the problems with heart disease. Do you believe that?
Well, I do to an extent. I think it's a really good point. I think if you're going to not address your diet, you're in trouble. You know, it doesn't necessarily mean that everybody needs to be vegan or vegetarian. There is a lot of, it depends kind of on your baseline, your predisposition, your risk factors. Certainly we know that, you know, a lot of animal fats are bad for you, saturated, you know, trans fats are bad, and unfortunately a lot of those come from dairy and meat and animal products. However, a lot of health benefits from lean meats, you know, salmon, certain fishes, you know, chicken sometimes. And so I don't necessarily tell people that you have to completely get rid of meat. It kind of depends. You know, I look at, you know, you have to kind of look at each person and say, well, is your cholesterol completely crazy? Are there benefits or changes that you could make in nutrition? We have some really good data. I don't necessarily recommend that people just go to one particular diet. Like a lot of people ask me about, oh, should I do the ketogenic diet, or should I, you know, should I cut out all the carbs, or should I get rid of gluten? And the answer is, well, no, not necessarily. It depends on what's your genetic profile. We definitely have good data that shows if you do more, you know, like of a Mediterranean type diet, people tend to do better.
I keep hearing all about that. So much good information. I think the moral of the story is women pay attention. Heart disease, it is for real.
It's for real.
All right, we'll get our red dresses out, Dr.
Put them
Uddin.
on. Yep.
Thank you so
Thanks
much
for having
joining
me.
us this evening.
Appreciate it.
Take care.
All right.